So I was looking at videos that sometimes throw me over the edge when it comes to the narcotic prescribing guidelines. And I want you to really, because there's a trigger warning with this video, whether you're a provider, an insurance provider, an actual medical provider, or anything like that. Okay. The reason you guys need to stand up and change this is because that guideline has ruined lives and has created a system that will label and destroy your life to be able to fit the narrative that they created. Okay. Prior to those guidelines, prior to 2016, because I was going through my records and looking at my old records, the reason, let's say, lorazepam was prescribed to me was because of how serious my gut issues had gotten and the fact that I couldn't hold food down because I was constantly vomiting. Nausea medication was not working. On the contrary, I was having side effects to said nausea medication because long-term Reglan use can cause psychosis and other mental disorders. So yes, Ativan or lorazepam was used to reduce the amount of issues I had with my gut so that I didn't have to take as much nausea medication, because by then I was already on suppositories for nausea meds because my migraines were constantly putting me in the hospital. Mind you, yes, lorazepam or Ativan is used for anxiety. But prior to those guidelines becoming a huge effect, it was prescribed by my GI specialist and was monitored by him without the stigma of anxiety. We didn't start calling it anxiety or me having issues with anxiety or trauma until I started to suffer medical trauma and I started to resist treatment, because by then they were sending me to a psychiatrist for medications that were for me not to throw up. And I didn't know what to say at these appointments, because it's like, I don't feel anxious the way you talk about anxiety. Anxiety to me, I only feel anxious when I'm sick. Like if I take the wrong antibiotics, if I have a lot of inflammation and I'm in excruciating pain, that's the only time I feel irritable or anxious. When my physical pain is controlled, I don't have this problem. And at that point, I didn't need high dose of any form of narcotic. We started needing all of that shit when you guys started changing the way you prescribe medications and started adding all kinds of other medications. When amitriptyline wasn't working, when Boostbar wasn't working, when all these other medications weren't working, because you weren't addressing the issues in my gut, which is severe gastritis since childhood. Severe gastritis. But you can't keep me on those medications long term either, because then I start having reactions to long term omeprazole use. So you have to be switching it up. But because of the DEA guidelines, it makes it impossible for doctors to really play with those medications to find us the right dosage or to find us the ones that work, because we have to go through 3 or 4 different doctors to get the medication that used to be prescribed by one, and never had any issues with misusing, overusing, or any underusing or not wanting to be medicated, because essentially the right medications were given and there was no issues until you start to take away the right medications and started to force the wrong medications upon us in order to even consider giving us back the medication that was working, because you wanted to change that, because you thought people were misusing it, because we got suicidal. We got suicidal because you weren't treating us. And many people turned to the streets. Many of us disassociated to the point where I'm missing years of my life. You don't get to do that and then put it all on the patients. You as a culture and a society did this. You created drug addicts where there wasn't any because you didn't want to treat them with the pain medication that was right for them. Because in my particular case, I got exactly 20 pills a month of Tylenol codeine. And I got 90 pills a month of lorazepam because I had to take one pill before meals. And it worked. I didn't have to be on a shit ton of pain medication the entire goddamn month. Dr. Boyd kept me on a very beautiful regimen. Once I was on chemo and all that shit was destroying my body, my GI specialist, Dr. Wiseman, I believe, was the one that prescribed the lorazepam before all the chaos began. You guys don't get to do that. Because now that I'm looking and back at the notes, these doctors were really trying. It was the new doctors from 2018 or 2019 forward. You were the ignorant, bias doctors that didn't look at those past notes and all of the harm that had already been committed on my body, trying to experiment out of using what was working, which was the Tylenol codeine and the lorazepam. Not together, mind you, because at the time I didn't use them together. I used them as indicated until I started to disassociate from the excruciating pain I was in, which still happens. And I've proven that I'm not taking anything, so you can see that I still disassociate severely and pass out from the physical pain that I'm in. Not just physical pain of my body, but my brain. Your brain is not supposed to hurt this much, guys. It's not supposed to hurt. You're not supposed to have headaches and migraines on a daily basis. You're not. And the fact is, the migraine treatments, they've tried everything. It's not like they haven't tried. But without safe housing, you can't keep trying to medicate people like me because you're putting us at risk of people misinterpreting what is happening to our bodies, even though they're misinterpreting it regardless, to be able to prove mental health problems and substance problems where there wasn't any. Because I was a compliant fucking patient for as long as I possibly could. Until I started to disassociate and tried to take my own life, then all of that gets used against us. And it's not because our conditions got better that they stopped treating our pain. It's because they stopped seeing our pain when they drove us to suicide. They stopped seeing our pain when they drove people to the streets. They stopped seeing our pain when they could not cure us, when the insurance couldn't get good results from complex cases. That's all this is. It's genocide on disabled people. Whether you want to look at it or not, you're murdering disabled people with your stupid ass guidelines that don't work for everybody in complex cases. Those guidelines should have never been used on complex cases. They should have never been used on complex cases. You don't know how many elderly people I know that have given up on life because of you motherfuckers, and who are judged on a daily basis because they choose THC and CBD because you abandoned them as medical professionals and medical institutions. You abandoned them. You need to take responsibility. You as doctors and nurses need to stand up for your patients so these laws and regulations can change. Otherwise, people continue to suffer. And when you have biases of your own and we end up in the hospital needing help, even when we're not asking for narcotics, you treat us like shit because of your bias. And then we don't want to go to the hospital. So fuck you. Go love yourself. And I hope that none of you are ever in any of these situations. Don't deserve my fucking tears in this, dude. I'm so furious at you people because you're still blaming the patients when it was your regulations that created this problem. Get that through your head. And yes, there was areas that were flooded with overuse of opioids. I get that. A lot of people are suffering the aftermath of that. But look at the areas that they did that in. It was intentional. It was intentional. I wish you guys saw that. To make poverty a crime. Not because complex cases didn't need help, but to make poverty a crime. So that complex cases stop asking for help. And we do. Eventually we stop asking for help and then get judged as drug addicts and substance abusers because we choose marijuana and CBD as our medicine after we've been abandoned by the system. I also use herbs, and I'm seen as a crazy person for doing that. But guess what? Y'all were killing me, and it's on paper. I started to heal myself, and it's also on paper. When you abandoned me, not because I wasn't requesting what I needed, but because it was being denied for years. Oh, there's no such thing as neuropathy treatment. There's nothing we can do for your neuropathy. There's nothing we can do for your curling in toes. There's nothing we can do for your ankle that's always rolling, or the knees that are always going backwards. There's nothing we can do for the shoulder that's always popping out of place, or the thumb that keeps popping out of place. Or what about your ring finger when it gets stuck and swollen because it's not in its joint? We can't do anything about that either. We can't do anything about your gut issues. Just eat slower and eat smaller meals. But I'm wrong for needing a full 24 hours to enact my maintenance care. Okay, then pay me to do the maintenance care that you're not providing. Pay the fucking chronically ill, complex cases that you don't want to treat. Pay us to treat ourselves. Give us the money that you're giving our specialists and our nutritionists and our insurance companies. Give it to us, and we'll stay out of your fucking way. But you don't like that, because us staying out of your way actually develops programs and meal plans and lifestyles that actually make people better. And Big Pharma doesn't like that. So instead, they flood the DEA with money and resources to continue to harm doctors who are actually trying to help people. I'm sorry, but the pattern is very obvious. And if that isn't the pattern, then the DEA should be actually trying to correct all of these mistakes, if you ask me. If it wasn't intentional, then I should be seeing the DEA actively trying to correct and change these policies so that people stop being harmed. I mean, that would be the right choice. When you realize that you fucked up, you correct your mistakes, right? Unless it wasn't a fuck up, right? Go love yourselves, truly. I hope you learn to love yourselves, because one day you will go through what you've put everybody else through. One day you will get sick, because everybody gets sick. Everybody gets sick. And one day you will have to live through the system that you created, and you will have to survive the system that you created. I hope it's changed by then. I hope you actively work to change it before you get there. I love you, and have a good day.